My name is Lina Mwango from Ciheb, Zambia. Let me read through the protocols so that everyone who comes up front can ride on the protocols. So the country director, US CDC, the National AIDS Council Acting Director General, the Assistant Director, Adolescent Health Services, the Country Director, University of Maryland, the Provincial Health Directors, Zambia Correctional Services, the District Health Directors, ladies and gentlemen, may I simply say all protocols observed. We'll move on to the next item on the agenda. I will ask the Provincial Health Director from Western Province, Dr. Lisulu.
This is a meeting that we review that which we have been working together, spearheaded by CIRKUITS, UMB, for the last 5 years. It is a collective effort, starting from the funders, PEPFAR, the American people who have been gracious to give us that financial support, through the government of the Republic of Zambia. I'll ask all of us to give a clap to the Zambian community that has benefited from all the efforts. So even as we review that which we have done, in picture, behind the nameless numbers, it's a life that has been transformed in the different spheres. And we are grateful as a ministry, as a government, for this effort through the support that we have been getting from the American government. Let's take the lessons for what they are, that they are lessons, but behind the lessons, there is a human face to it.
The University of Maryland has been implementing the CIRKUITS program with support from PEPFAR through a CDC cooperative agreement, and the primary focus has been HIV prevention programming for hard-to-reach populations and also adolescent girls and young women prevention. And successfully, they have led CDC Zambia's flagship DREAMS programs in Western, Southern, and Eastern provinces. The CIRKUITS team has also been instrumental in showcasing the work by producing key peer-reviewed scientific products, including publication of 9 scientific manuscripts on index testing and targeted community-based case finding, implementation of pre-exposure prophylaxis among vulnerable population, high HIV prevalence among sexual partners with risk of intimate partner violence, effectiveness of HIV self-testing in reaching vulnerable populations. Congratulations on those publications. Additionally, CIRKUITS developed 40 abstracts on various topics based on program work that they have been implementing in the last 5 years. Selected abstracts focused on achievement of the last mile HIV epidemic control, determining the number needed to test, collaborating with faith-based organizations to deliver HIV services to men in Zambia. This is through the Faith and Communities Initiative. DREAMS interventions among AGYW community-based peer education and uptake of sexual reproductive health and HIV services among rural adolescents. CIRKUITS has also supported the development of 8 national health guidelines in the 5-year implementation of the project. The CIRKUITS project was awarded a total of about $33 million over the 5 years of implementation. And in addition to all the scientific products that I've already mentioned, here are a few key achievements. CIRKUITS has managed to provide DREAMS interventions to over 100,000 adolescent girls and young women. 17,500 adolescent girls and young women were reached with PrEP services in the DREAMS-supported districts of Monze, Mazabuka, and Chipata. Hard-to-reach populations reached with HIV prevention services with only the 3 districts that I mentioned, demonstrating a coverage of more than 90% for the first 95 in the recently completed FSW BBS. So it's just these 3 districts where you have reached the first 95 for the FSWs.
The government of the Republic of Zambia, through the Ministry of Health, has been in partnership with the University of Maryland for nearly 20 years. And over the past 2 decades, the University of Maryland has implemented several key HIV prevention and treatment projects in Zambia. Among them is the AIDS Relief Stop Maternal and Child Health HIV Transmission Project, Zambia Community HIV Epidemic Control for Key Populations, the Ciheb project, and now the community impact to reach key and underserved individuals for treatment and support, the CIRKUITS project. The CIRKUITS interventions is in line with the Ministry of Health's mission of providing equitable access to cost-effective quality healthcare services as close to the family as possible, with the mission of leaving no one behind. Through index and social network testing, the project tested and identified people living with HIV in priority and vulnerable populations who were linked to treatment, whilst those who tested negative for HIV were linked to prevention services. Family planning, VMMC, and condom promotion distribution were some of the interventions that were given to those that tested HIV negative.
In this meeting, would love to just highlight the progress that has been made. We all heard that the CIRKUITS project has been implemented for the past 5 years. Our second objective is to share testimonials from individuals within the priority and key populations who were directly impacted by the project's services, emphasizing real-life stories that illustrate the project's significance. So in this meeting, we would not want just to talk about numbers, but we also want to hear real-life stories about how the project has impacted the beneficiaries.
University of Maryland has been privileged to work in Zambia for the last 2 decades. We started with the AIDS Relief Project in 2004, led by Dr. Rob himself when he came to Zambia. And we've had the great fortune to work hand in hand with MOH over the past 20 years. From AIDS Relief, we went on to the SMOCT project, then Ciheb, and now CIRKUITS. The CIRKUITS project started in 2018, and it's had the key objective has been to focus on closing the gaps to HIV epidemic control by making sure that everyone has access to care, particularly the key and priority populations in Zambia. And this has been closely aligned with the MOH National Strategic Plan of 2022 to 2026, where the mission is leaving no one behind. CIRKUITS has worked in 4 provinces, all 4 CDC-supported provinces, Lusaka, Western, Eastern, and Southern. And we've had the programmatic focuses have included key populations, priority populations, the DREAMS Initiative, Faith and Community Initiative, incarcerated persons, and COVID vaccination. And this has all been a wraparound approach to achieving sustainable HIV epidemic control in Zambia. We need to, first of all, sustain the gains that we've made in HIV epidemic control. From testing to linkage to viral suppression, Zambia has made amazing progress, and we need to keep up the efforts and keep going. We need to continue investing in resilient and robust community health systems to respond agilely and nimbly to whatever the next health crisis is. We need to strengthen our supply chain to maintain needed commodities. We see here a picture of Lena pointing to a sign that says, PrEP is offered here. And I'd like that to be true. It would be wonderful if that was true everywhere in Zambia, that PrEP is offered here and people can access it, and there's no challenges around stockouts or anything else. We need to continue supporting DREAMS and DREAMS-like activities to support and empower the adolescent and young people in Zambia. And we need ongoing sensitization of our workforce and our community around the needs of adolescents and the key populations.
I stand here as one of the beneficiaries in that capacity building program, including my colleagues from the district level, the district AIDS coordination advisors. I'm also here to testify that the project has scored a first in the provision of biomedical services. Particularly, they have been the lead in helping us to understand and provide PrEP, and also in ensuring that all the girls who were at high risk of contracting HIV and AIDS have continued to maintain the seroconversion. The third service that I can speak about was the revamping of the friendly spaces for our adolescent and young people in Chipata, Lundazi, and Petauke, which gave at least a voice to our adolescents for them to demand for health services. So adolescents came to safer spaces, receiving information on adolescent health, which included also HIV treatment and care, messages and prevention services. I'm also here to confirm that the project has been able to provide that demand creation related services to key and priority populations. Among those, our institution is Namseche, which has been a huge recipient of that service and care. And I'm happy to report to this house or this meeting that because of the positive example which has been laid in that provision of services to correction services, the National AIDS Council has lent a leaf from this organization. And I'm happy to report that in all the 10 provincial capitals, one health facility has been identified to provide that supportive related services.
We are going to have success stories from our adolescents. They are going to share with us how the DREAMS program has impacted on their lives. They are going to share with us how their journey has been with DREAMS.
My name's Fortune Jilala. I'm 23 years old from Nakambala Dream Center, Mazabuka. So I'll tell you a little story about me and how I got to know about DREAMS. So I got to know about DREAMS in the year 2020 through a mentor who was doing door-to-door mobilization in my community. So after hearing everything that DREAMS was all about, I was very much interested and I decided to join. So after joining the DREAMS program, I underwent 13 sessions of the Stepping Stone. So in those 13 sessions that I attended, I learned a lot of things. One of them, which is how to protect myself from acquiring HIV, STIs, and also unplanned or early pregnancies. So in 2021, I finished those 13 sessions. I was very much happy to be awarded with a certificate that I never paid for, because at the time that I was joining, I didn't expect to be given a certificate at the end of the day. So that made me very happy. Thanks for that, our DREAMS. So after the 13 sessions and the certificate, the same year, 2021, I was privileged enough to be one of the beneficiaries of skills training. I underwent skills training at St. Paul's Training Center, which is a TVETA accredited institution. That was for 6 months. So in those 6 months, I learned how to weld, how to cut, and how to join. All kinds of methods. I learned everything. So before you people finish clapping, I want you to clap for the best part of this training. That training that I underwent, it was paid for. Starting from the safety boots, the fees, the books, everything that I used there was paid for. I didn't have to pay a coin. This is just how good DREAMS has been to me. So as I speak today, I am a qualified welder. I have a certificate. So I'm very much happy for that. With that certificate that I got, I was able to get a job at the local market in Kawabola, where I come from. So I'm able to earn money. So before, don't be happy. Listen to everything. So before I went to that training and before joining Dreams, in the community where I come from, it's a very normal thing for a girl of my age kutoka pa nyumba once it's 13, 14 hours in the afternoons. You even start saying, okay, where are we going today? Like, it was just a normal thing. So after I joined Dreams, I used to drink. Let me say I was a heavy drinker. Boys in my community would say, "Nimkazi wa bwanju." Like, I would drink whatever you'd provide. I would never get drunk from morning till sunset. That's just how bad I was. So after learning everything in the stepping stones, I stopped drinking. Number 2, here where I am, I'm independent. I can make money for myself because of Dreams. I don't have to depend on men to give me money. After exchanging sex, and the HIV, syphilis, and other things. But after the knowledge that I was given, today, I'm proud to say I'm able to negotiate for safer sex. So in the same year, 2021, after my training at St. Paul's, I continued going to the Dream Center. Not forgetting my aunt. I was raised by a single mother. I have 2 younger siblings. So in the process of going to the center, I underwent ELA sessions where I learned on how to enterprise myself, how to find capital, how to run a business, and how to market my products. So after those sessions at the center would cook, the meals would be sold to the clinic, other people nearby, and at the Dream Center. The profits would be shared among me and my fellow AGYWs at the Dream Center. So with that profit that I was given, my own share of the money, which was 200 kwacha, I decided to start up a samosa business. So after starting the samosa business, I would say, I don't even know how to say it right now, but because of Dreams today, I would say my brother, who had dropped out of school, who was in his 2nd year, he was studying nursing at Mazabka College of Nursing. In the first 3 months of running the samosa business, I was able to raise 4,000. And at the time that he was chased from school, I had raised the sum of 15,000, which was used to pay for my brother's tuition fees. And as I speak today, I would say I'm a proud Dreams girl. I'm determined, I'm resilient, I'm empowered. Because my young brother, as I speak now, they said the portal has been open till the 6th of October, 2023, Yaba Nursing Council. So the money for paying the exam fees was raised by me. Not just me, was raised by the Dreams program, because Dreams taught me how to make samosas, one. It taught me how to save money. It taught me to say my health, my life comes first. Before money, my health first. I would say I'm very grateful. Thank you very much. Here where I stand, just that, let me say I forgot my prep card at the hotel where I'm lodging, sorry to say. I would have shown you people to say, from the time I started taking prep in 2021, I've never missed an appointment. It's either I'm before time or I don't know what to say. Panopeni, if at all you are doubting, you can bring someone to test me. I'm HIV negative. All thanks to Dreams and what prep has done for me. And I'm even planning on upgrading because I know to say, one, I won't acquire matenda. No HIV, no STIs, no unplanned pregnancies. Thank you, Dreams.
I stand here as a beneficiary from Dreams and also Maryland, where I was tested for HIV. And it was from there I got to know my HIV status, because before I used to feel scared and maybe ashamed of going to a health post and test for HIV. But because of the how welcoming the mentors were to us and the knowledge that we got from them, I got to be comfortable with opening up to them, and I was tested negative. And knowing that I was at risk of contracting HIV and AIDS, I was encouraged to start PrEP. And since then, I can say that I have been taking PrEP for 3 years now, and I have maintained my HIV negative status. All thanks to the support group and the adherence trainings that we used to have, and also the support from the mentors and the health workers that were there. It has been a good journey, and I would just like to say thank you to Dreams, and also thank you to the implementers of this program. It has been good, it has been amazing, and it's not only PrEP that I have learned from them, but also other programs that have benefited from Dreams. For that, I can stand to say I'm more confident now. As an adolescent, I have confidence also in maintaining my good health status. I am more determined, resilient, empowered, AIDS-free, and mentored safe girl.
I was almost fished out of school, but because of Dreams, I managed to complete my school last year and obtained 12 points. For that, I'm really grateful, because if not for Dreams, by this time, I would have been a grade 2 failure. But I'm a graduate with distinctions. For that, I'm very grateful. After I completed the 13 sessions, I was awarded a certificate. And that certificate is the one which made me to be enrolled as a counselor, to start learning psychosocial counseling. I was awarded a certificate of psychosocial counseling. As I'm speaking right now, I'm working at a certain private school as a child counselor. For that, I'm really grateful. After graduation, I moved on to the ELA lessons, on where I was taught on how to maintain your skills, even about talents. As for me, I was more interested in the skill of tailoring. I started going at Dream House to learn how to do tailoring. As I'm speaking right now, I'm able to make my own items. As you can see outside there, I'm the one who was making those items. I'm able to raise money. I'm able to raise money and earn a living at the end of the day. I'm able to support myself. Being the firstborn, I'm able to support my single mother. We have been living in a house which is not plastered. But as I'm talking right now, I left money with mom so that our house can be electrified and plastered. For that, I'm very grateful, because if not for Dreams, by this time, I don't know where I could be. I would have been going around looking for boys so that they can give me money. But because of Dreams, I am here as a girl child who is determined, who is resilient, who is even empowered, who is able to support my siblings. For that, I'm really grateful. I'm wishing that my fellow girls who have interest in Dreams, so that they'll be able to support themselves, even to support their families. For that, I'm very grateful. Oh, thank you.
Mwa 2020 mwa November kuna mwanchile kutoka Tanela Mulikani.
In the year 2020, she met a friend from Dreams.
Kuna mwanitolokezili kakaufela za Dreams minimo kona kujoinela.
She was introduced to Dreams and she joined Dreams.
Kuna mwani kenezi Dreams, kuna mwani kale kuituta.
She started her lessons, her 13 sessions.
Kuna mwani chekuto itutela za PrEP ni family planning.
In the stepping stone lessons, she was taught on family planning and PrEP.
Chwaleka mone nibonela mikwa eneneza akona mone ezeze fa kuli kandili kazeni tusefela zona ukensa kuli nebani lutile kabutokwa wazona.
So she came to know about PrEP and family planning, and she stopped whatever she was doing in the street.
Kona moni kalezi kukuba nibona ba dreams mikono mba kalezi kunibulea kuli evenjina la takuweza kakosi kabu CBD.
She was one of the beneficiaries under Dreams. She was a CBD.
Dreams has showed me where to get family planning without stigma. I couldn't go to the clinic knowing to say I'm young, and at the clinic, only big people are found there. And when you go for family planning, what they would say would be, akakamana scanvera, that's why I katenga family planning. But when you go to a dream house, you'll be comfortable because the people that you find there, they are the ones that taught you how to do it. So I'm still getting my family planning even now at Dreams. All thanks to Dreams. Because I don't know, I would have had maybe another child by now. So after that, there came a time when they were choosing people that would go for a vocational training. I was one of the people that were selected to go for psychosocial counseling. I went for psychosocial counseling. I studied. I made sure I studied hard, knowing to say, this is the only thing that I can do without paying anything, including my books and a pen, a mere pen I couldn't buy. Dreams could provide everything for us. The only thing that was needed was my brain and my body to be there. I could leave my baby with another child, just a 10-year-old child, when my baby was only 4 months old, and go to school to go and study the psychosocial counseling. I got the certificate free of charge, without pay, because of Dreams. I really appreciate. I don't know what to say. Thank you, Dreams. What you have done for me is very, very powerful. I started my psychosocial. After getting my certificate, there was an advert that they wanted mentors. I applied. After applying, I was called for interviews. After being called for interviews, I was still selected to. The little that I get from Dreams, I'm able to take care of my baby who doesn't have a father. At least next year, my baby will be going to school. All thanks to Dreams. If not for Dreams, I wouldn't have been here. Thank you.
The Dreams initiative will continue. HIV prevention services for adolescents and young people will continue. And then we'll also continue working with KP populations. And that's covered by Strategy 2, which will continue with the KPIF model. And then in addition to that, the only other thing I would probably add is harm reduction strategies. So Dr. Cassidy mentioned about harm reduction strategies. University of Maryland, working with the Ministry of Health and several other stakeholders, has already started working towards that. So Advance will continue supporting Ministry of Health and in getting these services set up. So
one thing that we have learned well at Zambia is targeted response. Those of you that have been long in the sector know about many surveys that we have undertaken. Many of our healthcare workers user-friendly when it comes to, it's an indictment on us. But if it may, the National AIDS Council and the Ministry of Health, we are currently rolling out Our belief is that we can then scale that out, roll that, have so coming now back to CIRKUITS. But as we went on, I got so let me just lastly thank the investor and all the partners for making. We have got evidence of success right on the ground. With that, I would like to not close CIRKUITS. It's not. Thank you so very much. I want to believe that I will not be disappointed that I stood.
The project has been a 5-year endeavor funded by the CDC via PEPFAR to support HIV efforts in Zambia. And we're focused predominantly on HIV service delivery for key and priority populations in Zambia, which tend to be some of the most marginalized and underserved communities in this country. Over the past 5 years, we've developed novel and innovative strategies to reach these groups. And we conclude with approaches such as index testing and social network testing, and building out differentiated service delivery models like the Dream Centers and safe spaces for key populations where they can access healthcare and other services in a stigma-free environment. At the end of 5 years, we've reached over 400,000 people in Zambia with HIV services, identified over 36,000 new HIV infections, or identified 36,000 people with HIV infection, whom over 93% have been linked to antiretroviral therapy. We've also seen 98% PrEP uptake among those eligible for it. So some remarkable achievements in that regard. We've helped provide service delivery to over 50,000 members of the key populations in Zambia via our KP Safe Space approach. And via the DREAMS initiative, we've reached nearly 100,000 adolescents and young girls in Zambia with the holistic approach that DREAMS provides for HIV prevention and personal empowerment. Very proud of these achievements. And in addition to these programmatic achievements, we've also worked closely with Ministry of Health to develop forward-looking health policy to advance healthcare and approaches to healthcare for these groups in Zambia, really developing new approaches to PrEP and expanding harm reduction policy for people with substance abuse disorders. In addition, we've been building capacity in Zambia, working towards sustainability. We've trained over 7,000 healthcare workers in Zambia. We've also built capacity of local organizations to continue the work that we're doing. And we've created permanent infrastructure, building 6 Dream Centers and multiple community posts in youth-friendly spaces. These will all contribute to the health of Zambia for years to come. In addition, we strongly believe that the innovative best practices here in Zambia should be shared with the world. To that extent, we have developed a robust scientific pipeline where we share our best practices with the scientific community. We've presented our work at over 7 different international conferences with 40 conference abstracts. And we've published 9 scientific peer-reviewed manuscripts on the work that CIRKUITS has done in Zambia. Because Zambia is a progressive, innovative country, and the innovative approaches here should be shared with the world. In conclusion, our CIRKUITS approach has built capacity and had tremendous impact in Zambia. There's evidence of Population impact surveys and the biobehavioral surveys have also demonstrated the impact of the CIRKUITS project, showing remarkable achievements towards epidemic control in all the districts and populations that have served. In conclusion, we believe that the approach taken by CIRKUITS can be scaled up and move forward with best practices taken to Ministry of Health, implementing partners, and the follow-on grant. And we look forward to continue supporting the health of all Zambians under the new award, which will be Advance, led by Ciheb Zambia. Thank you so much for this opportunity. We're so grateful for our partnership with Ministry of Health and CDC and all implementing partners and the communities that we've worked with to conduct the CIRKUITS project and achieve these remarkable results together. Thank you.
You can join us, dreams in Arange. Aramulemona, Niva dreams Ivalemilanga, dreams yaro, happy dreams in Arange. Dreams in Arange, Aramulemona, Niva dreams Ivalemilanga, Imirimo yabo. Go Tony! Come back, come back, come back, come back. Go Tony! Go Tony! Sit up there! Sit up there! Enjoy the BT! Enjoy the BT! Go Tony! Go Tony! Sit up there! Sit up there! Enjoy the BT! Enjoy the BT!
That was our dreams team. Thank you very much for listening. I now hand over to Adebayo for the next session. Thank you. You are not clapping for me.
All right, thank you very much, Monde and the team. Permit me to stand on the existing protocol. For me, after listening to those testimonials and the goodwill messages, the next